Hello there. We continue to debunk myths around health and medicine, particularly in the case of coronavirus, which, as you know, is now being declared an infodemic by the World Health Organization. So we're going to do two things. One is we're going to address a series of questions and try and debunk them from our medical expert today. And we'll also try and get a sense of where things stand, but from a specific point of view, and that's internal medicine. I'm happy to be joined by Dr. S. Chatterjee, who is a senior consultant of internal medicine at the Indraprastha Apollo Hospitals in Delhi. Dr. Chatterjee, thank you very much for joining us.
Thank you.
So first question, as someone who is heading an internal medicine function, how are you seeing the progression of coronavirus or COVID-19 at this point?
See, if I have to see the entire world statistics and what is happening in India, the numbers are increasing. There's no doubt the numbers are increasing. I've been discussing this problem with quite a few of our colleagues all over the country, and I'm asking them, because we are not doing the testing, we really don't know where we stand. Okay, but I've been asking my colleagues as to, are they seeing a lot of patients of suspected COVID? Means from the history, from the examination and all these things, are we really seeing that many numbers? Because if it has gone to the community, all doctors should be seeing that many number of patients, or at least receiving a call from their own patients that, okay, we are suffering from this illness, that illness, this is the throat pain, fever and all that. But most of us feel that the numbers have really not gone up that much as far as our patients go. Okay, so that is one way to check it. Obviously, the testing is low. The government, I think, in the next couple of days is going to come out with new advisory where they are going to ask us to test more number of people. But if I have to see the numbers, we are still much lower than what Europe is facing or what US is facing right now.
Right, but you're saying apart from the numbers of positives against the tests done, which is less than 3% right now, you're saying that the intuitive feeling that you're getting is that there are not too many people coming with these kind of complaints to doctors anywhere in the country amongst those you're talking to.
This is what I feel. Obviously, right. I work at a high-end hospital, and my spectrum of patients and my spectrum of friends, obviously, the doctors who face the maximum problems are like people who are running the Mohalla clinic or who are working in a primary healthcare center, because mostly cough and cold and the majority of the Indian population would first report to them. But the people that I am speaking with, I'm really not getting an idea that is overwhelming right now. But what will the next 2 weeks, I'm sure the next 2 weeks will tell us as to where do we stand, has the lockdown been successful, and are the cases really increasing in numbers?
Right. So, and why are these next 2 weeks critical? I mean, what is it about the progression of this disease that that makes this period important?
See, what we have seen this is a new disease, so people don't know much about it. But if you see the graphs of different countries, this is the time when the numbers really started rocketing up. Okay, so this is the next 2 weeks. That's why we say it's important. We're not saying that we should overcome the disease. That is not possible. We'll not be able to overcome the disease. But if by any chance we can plateau this curve, we are more than happy.
Okay. Now, how as someone who is again in internal medicine, how do you see the prospect of treating or curing we'll come to later, but at least treating a patient that walks in today?
See, obviously it is something new for us as well. As days go by, we'll get more experience also. We are obviously we are in constant touch with other centers which are treating this disease. Apollo is itself a huge group spread all over the country. So we ourselves have a huge number of doctors with whom we can discuss at different centers. And obviously, being in Delhi, we are in touch with All India Institute, RML, and Safdarjung Hospital, where most of us are batchmates or senior to us or something like that. We are discussing. So we are discussing amongst ourselves continuously. And obviously, this time, I must say that the government advisory is very, very regular, unlike other instances. Obviously, because maybe we had some time to prepare, the government advisory is coming regularly, which we discuss amongst our microbiologists, our pulmonologists, friends, and all these things also.
Have you had any patients specifically with coronavirus?
We have had patients. Basically, they came as a suspected. They didn't, because as a private hospital, we're not allowed initially. But in the last 2 days, we have had patients who have been suspected. And since we have been allowed to test now, although these patients were tested outside and retrospectively, or once they were admitted in an isolation ward, because we had a high suspicion that they would be COVID patients, they were admitted in a suspected isolation room for COVID, and 2 cases have come out to be positive over there.
And what's the treatment path for these patients?
See, we are following what the AIMS protocol says. Okay, we are even using we are at this moment following the same protocol. Obviously, depending on how the patients go about it, we might change the protocol a bit. But obviously, after discussing amongst all of us, and also keeping the government advisory at the same time.
And I mean, are you able to throw more light on this protocol at this point?
See, we have been using, as I said, it's two patients basically, so the numbers are not too high.
Sure.
But chloroquine, azithromycin, and using the antiretroviral drugs, obviously being used on a compassionate ground rather than having a definite evidence that they are really going to benefit our patients.
Okay, but you are convinced that this using antiretrovirals or chloroquine is the combination is something that has a better chance of working as opposed to anything else?
See, we don't have much evidence right now. So we are going by our previous experiences. And all these experiences have also come through what was being used for SARS and all that. So it is, and since India was not the first country to be affected, we are going by experiences of the other countries, and we are getting advisories from our ICMR, from the All India Institute people. So we follow all those things, and then we decide amongst ourselves, okay, theoretically speaking, this looks okay for the time being. We might make a change in the next couple of days, but since it's just the beginning, let's not make any change, because experience also has to grow as days go by.
Right. And I mean, last question on the patients itself. So what is the symptoms that they are showing right now, and what could be a sign of recovery or not?
See, unfortunately, the patients who came and who were kept, because otherwise we are not allowed to keep these patients, we are sending them to RML at the outset whenever we are suspecting. Say, most of them actually we refer to RML, whom we thought could be suffering from COVID. But these patients who were suspected, because they were sick, we could not refer them to other centers because they were really sick. So they came with breathlessness, and the lungs showed pneumonia, and they had very low oxygen content. So that's why they had to be kept in our hospital, and we kept it retrospectively, and they have come out to be positive.
And you're obviously administering oxygen, and maybe I'm assuming also they've not reached the point of using or needing a ventilator?
They didn't require a ventilator, but the oxygen requirement is very high.
Okay, and which means their lungs don't have the power to breathe on their own, or?
Yeah, absolutely. Right. So that was the main issue. And so that's why these two suspected patients who were really sick, the major issue was low oxygen, what we call as hypoxia.
Right. Okay. Can I ask you a few questions which are a little more general and more in the nature of myths that keep coming up? So the first is, and I'm sure many people are asking you these questions as well. So the first is, can I take garlic water and will that help me prevent or make me stronger or more resistant to coronavirus?
See, I have been answering such type of myths in the last couple of days very
Boiled garlic water, sorry, yeah.
See, where is the evidence? Overall, they might benefit some with their qualities. They might soothe your throat. They might improve your symptoms. But if it would have been so easy, it would have been a worldwide thing. There is no evidence. See, we in allopathy believe in evidence-based medicine. Till the time we have no definite evidence, we cannot recommend this as a modality of treatment. And I think it might just maybe soothe your symptoms. It might reduce your symptoms. But as far as treatment goes, I think till now we have no proof that it has any role in the treatment of coronavirus.
Right. So therefore, I'm assuming the same would apply for boiled ginger water, alcohol, and so on.
100%. People would have been very happy if alcohol would have been the treatment. Half of the men would have been very happy, I suppose.
Okay. And the other one which keeps coming up, and particularly on our inboxes and our WhatsApp helpline, is, can avoiding ice cream and cold drinks for 90 days prevent COVID?
Don't think so. I would, obviously, all children will start crying to do that. Anyway, it's not available these days other than at home. But anyway, what I would say, see, what happens is mainly people have been saying that in a cold environment and all that, all these flu viruses, they grow better. So it must have been a hypothesis taken from there. But where is the evidence for coronavirus? People don't even know. What if people said, oh, heat would kill this virus? But then we saw that a few countries which are really warm are still having that epidemic. So we really don't know about this virus. I don't think that ice cream and all that is going to help. But I was just talking about that ice cream causes a low temperature, maybe in the local area, whether that will help or whether that will aggravate. we don't have any definite medical evidence for it.
So, if I were to ask a more blanket question, then, so there is no evidence to suggest that any such food or drink or can actually help protect you against coronavirus. Would that be correct?
We have been struggling to find out a treatment. If it were the entire world is struggling to find out the treatment, and if things would have been so simple and easy, it would have been really good for the entire world. What we are saying is that don't follow all these myths. Let's go by evidence-based medicine. Evidence-based medicine doesn't support all these hypotheses still.
Right. And last question. So, your advice to patients today, and people first, and what should they be doing, and at what point should they be checking themselves or going to check themselves if they feel that they've got certain symptoms, and what would they be?
See, from now on, I would not really recommend that the travel history is very important, because as days go by, all this travel thing is going to come down. But if you think that you are having a cough, fever, and a sore throat, just give it 1 or 2 days time, see how it behaves. Then if you become breathless, obviously you have to visit the doctor or your nearest designated medical center so that you can be addressed. But if there is a bit of a sore throat, cough, fever, maybe for a day or two, you can observe at home. Obviously, isolate yourself, because if otherwise you'll be spreading the infection to others also. Even if you're not suffering from COVID, I would say that if these are the symptoms, at this moment, it is better to isolate yourself at home, observe for it. If things are worsening, definitely contact your local doctor and a designated medical center so that you can be investigated if required.
Right, Dr. Suranjit Chatterjee, thank you so much for your time, and hopefully things will get better, and we'll come over this disease as we have in the past. Thank you so much.
Thank you so much.